Welcome to Your Need to Know. I'm your host, Catherine Reed, and joining me tonight is Jennifer Kanarek. She is the program manager for NV Rides. And if you've never heard of NV Rides, you are in for some astonishing information about how this service provides rides for seniors who no longer drive, which is a critical need, not just during COVID, but it's a need all year round. Thank you so much, Jennifer, for joining me today.
Thanks for having me. Good to see you, Catherine.
It's good to see you too. We did this several years ago, at least a couple of years ago in the studio, and now we're doing it remotely because this is what we do during a pandemic.
Yes.
But, you know, the need for seniors to have rides has not diminished. And if anything, COVID has been more isolating than ever for seniors in their homes. But I'd like for our viewers, I'm not going to assume that everybody knows what NV Rides is or how you started or who you serve. So I'd love for you to kind of walk our viewers through what the program is.
Yes. So NV Rides was started in 2014. We just celebrated our 6th anniversary. We are a collaborative program operating out of the Poses Jewish Community Center of Northern Virginia. And we are partnered with Fairfax County and Jewish Council for the Aging in Montgomery County, who runs a similar program called Village Rides, which really was one of the first models for this type of program. We are a coordinated hub of volunteer driver programs that transport seniors to medical appointments or the grocery store and social outings as well, pre-pandemic. And so what we do as a program is we help to increase capacity of community-based organizations that are administering volunteer driver programs to help seniors. Oftentimes, these groups are sort of interfaith councils of seniors helping seniors, some that are a little bit more active, helping those who are a little bit more isolated. And so we work with a variety of nonprofit organizations, shepherd centers, which we are very, we have a wealth of them in Northern Virginia, and they are all part of our network, along with villages, which are sort of grassroots communities, virtual assisted livings, if you will, that offer transportation and other services for seniors to help keep them independent in their home. And so transportation really is one of the top sort of emerging need, not even emerging, but existing need for seniors to be able to live independently for as long as possible.
That's true. And even though a lot of us have learned to order everything offline, including groceries, and I know that seniors have also upped their Zoom skills, because I work with seniors as well through Grand Involve. So, you know, there's a lot of new things that seniors have learned to do, but still social isolation is probably the greatest health risk to seniors, being isolated and not having a way to get to like a doctor's appointment or to buy your own groceries it impacts the health of our communities for those in our community who no longer drive. So the Shepherd Centers are great organizations, wonderful nonprofits, and you're right, we have a lot in the Northern Virginia area and other nonprofits too. And so when a viewer who is watching the show says, well, I never considered that I could be a volunteer driver, where would they start? What does that look like if somebody says, I think I could do this kind of volunteering?
Right. So if somebody wants to become a volunteer driver, they can get in touch with us at NV Rides. The number to call would be 703-537-3070. And we will give you all the information you need to know and answer any of the questions you've ever had about volunteer driving. It is a truly rewarding volunteer activity. And, you know, I'm not just saying that because I manage the program, but because we hear this from many of the volunteers who work with our partners, that, you know, what they give, really, they get so much more back in return, because really, you know, you spoke about social isolation and seniors, and, you know, not only does lacking transportation affect, you know, a senior's health outcomes, because they might not be able to get to their preventative checkups or follow-up appointments. But, you know, we know, and research shows, and it's been, you know, in the news a lot, that social isolation among seniors really does lead to chronic health issues. And, the loneliness and isolation can really have a very negative effect on the way somebody ages. And so something that we really stress with volunteer transportation is that it's really more than just a ride. When you're driving a senior and you're picking them up, you're having a conversation, and you're providing a really much needed socialization piece for people who, might not otherwise see anybody in the day. And even as as the pandemic has sort of, been going on, one thing that our seniors are really missing is their trips to the grocery store, because that is a socialization piece. And while we have been able to pivot our programs to food delivery, curbside pickups for our volunteers, there are many seniors who are still requesting rides to the grocery store because that is part of their daily routine, and it's what gets them out, and it's what keeps them active. And so a volunteer driver basically is not only a driver, but really somebody to lend an ear and really, care about a person.
And I'm sure your scheduling software too. And I want to talk about the fact that, if you decide to be, if you're a driver, that you have a lot of flexibility as a driver. If you have your own medical appointments or you have your own commitments, this doesn't mean that you're on call all the time. And I'm assuming, too, that you've got seniors who like to go to the grocery store on Tuesday morning, or they have a physical therapy appointment every Thursday afternoon. Right. And so there's a lot of ahead of time knowing what the needs are.
Correct. And so, and that is part of it as well, is that, you are able to, the central piece of this program, or what we're offering to our partners as part of the NV Rides program, is a internet-based ride scheduling system that we provide to our partners for, that is free of charge, which would be otherwise very costly for, a small community-based organization to afford on their own. And also oftentimes the organizations that we work with might not have a paid staff person. They might be completely volunteer run. And so this tool is really, really crucial in helping to streamline operations, to, reduce administrative time on scheduling rides. And so really what it does is it puts the onus on the volunteer to be able to choose the schedules that work for them. The volunteer driver has access to this database as well, and they'll receive emails on a daily, sometimes daily, depending on the need, and sometimes weekly basis from the organization that they sign up to drive for, saying, very specifically what the client or a member of the organization has requested. It will map out the ride for them so they can see exactly how much time they're going to be spending. It would also give them text reminders to let them know that they have a ride coming up that they've accepted. And it's a really, we see it as a really great volunteer engagement tool, because you can really volunteer as much or as little as you want as your schedule allows. And so you can, just like you mentioned, if you're going to Trader Joe's on Tuesday, and that you're one of the people that you drive goes to Trader, you can kind of do your shopping trips together, which is really, really nice. And the software will also give the volunteer very specific notes on what they need to know about the particular person that they're driving. If they do have some mobility issues, all of the riders that use our program do have to be ambulatory, but there will be some notes like uses a walker or uses a cane, maybe has some hearing loss. And so the volunteer driver knows what they're getting into with the ride before. And so they can choose their comfort level of the types of people that they're driving. So that's where it's a very, very, very useful volunteer engagement tool as well.
So it sounds kind of like Uber, but with more information.
Right.
So and it's free. And it's free, but
in most cases it's free or low cost. Yes.
Right. So you get information about mobility issues or any other kinds of issues that the person you're picking up might have. And we should mention too that you don't have to have a fancy car. You need a clean driving record. And I think one of the services that you also provide is the background checks, because there is a background check.
Correct. That's another component of our program, is that we provide the funding for all the background checks for volunteer drivers across our programs. Now, that is one of the services or one of the benefits of joining NV Rides for a small community-based organization, to be able to afford to make sure that their drivers are vetted. The other piece about the background checks is that it really gives the sort of program, because we're increasing capacity by networking all these partners together. And so because there's consistency across programs with background checks, we know that we can have a seamless flow of volunteers, so that partnering organizations could potentially rely on one another if there was a shortage of volunteers in one program. And so we know that they've been, vetted with the standard across all programs.
And when you talk about the drivers, just to give people some idea, on your website, it says you have 589 drivers that are parts of all of these different shepherd centers, faith-based communities, Mount Vernon at Home. And there's also a list of partners on your website. So people can go to your website, and there are hyperlinks out to the various partners so that they can choose through which organization they want to volunteer.
Correct. So you can either get in touch with us at NV Rides, or if you navigate to our website, www.nvrides.org, you will be able to click on a link that says Drive, and it will bring you to a map, and you can see geographically where all of our partners are located. And if you find one that's in your neighborhood, then you can call them directly, or if you want some more information about the program before you go in that direction, you can give us a call, and we can give you a brief overview, and there will be volunteer orientations given as well. Once a person expresses interest, we will, get together, do a little background overview of the organization, talk a little bit about how the ride scheduling system works and how they're going to, be communicated with with their organization, and then then they can start accepting rides. Once they've cleared their background check, they'll be getting emails from an automated database to see, if they've got time to give a ride.
And this is important too. When we come back from our break, I want to talk about your footprint, which is very large. You come with NV Rides for a reason. It covers Northern Virginia, and that's a lot of rides. So join us after the break. We are talking with Jennifer Kanarek of NV Rides.
Our fight against coronavirus isn't over. Let's wear face masks in public, stay 6 feet or more from others, follow state and local guidelines, and wash our hands frequently. Let's move forward together. Learn more at coronavirus.gov.
Social isolation is nothing new to older adults who no longer drive. Your older neighbors who have lost their independence rely on the kindness of others to find support and rides in times of need. This is that time. Put yourself in your neighbor's shoes. The pandemic crisis has everyone afraid and isolated in this lockdown, but for older adults, now more than ever. Many older adults are on fixed incomes and cannot afford taxis, Uber, and Lyft to get where they need to go. Seniors who need support and rides call their volunteer drivers angels. When this health crisis lifts, your neighbor will need help to get to their routine checkups and social activities. Their health, both mental and physical, depends on you. Give the gift of a lift so you can be part of the solution. You hold the key to making a difference. Sign up to drive today.
Welcome back to Your Need to Know. I'm your host, Catherine Reed, and today we're talking with Jennifer Kanarek. She is the program manager at NV Rides. And when we went to our break, we were talking about the sizable area that you cover here in Northern Virginia, the footprint that you have. And so tell us a little bit about how your partner organizations help you to serve such an enormous geographic location.
Right. Well, that's true. We are Northern Virginia Rides, NV Rides, whereas we were sort of started with some guidance from Fairfax County. We do cover outside of Fairfax County, Loudoun County, Arlington County, and Prince William County. And so it is quite a large service area. When we started the program, we were sort of open to either working with an organization that had an established volunteer driver program, or an organization or small community-based organization that believed that volunteer transportation could be a good component to their offerings. And so we are always looking for new partnerships and collaborations in the community. We do cover a very large area. Our partners do cover a very large area, but there are some pockets of Northern Virginia where it can be very difficult to find, to help a senior navigate transportation resources if they cannot access public transportation, or they have a limited income and can't afford to do taxis, Uber, and Lyft. And so there are some areas, and so we work with a lot of faith-based organizations, community centers, and any sort of community-based organization helping seniors to basically create a volunteer driver program. We will provide all of the tools and guidance and support in order to get a program up and running. And we are also, covered. So basically, our funding comes from the Metropolitan Washington Council of Governments, WashCOG, which does a lot of transportation planning for the region. And so when we talk about the Northern Virginia area, there's a lot of, they're all very different. The jurisdictions are all very different. There are, I like to sort of think of where we are as kind of an urban suburban area. But Fairfax County even can be very diverse in the types of areas where you can get it up to Great Falls, which is very rural, and there's not a lot of access to public transportation or any sort of county-run transportation up there. And so, we are really covering a lot of ground. And so we're always looking for multiple partners in areas to be able to complement the services that are already existing.
There are transportation deserts. I think one of them is like out in the western area of Fairfax County. Yes. Centerville has transportation. Yes. People can't get to Western Fairfax Christian Ministries pantry without taking 3 buses and 3 hours to do it.
That's interesting. You should mention Western Fairfax Christian Ministries is one of our partners, and that is one of the, and I guess this will bring us into our sort of pandemic part of the discussion, but Western Fairfax Christian Ministries works closely with one of our partners, Shepherd Center of Western Fairfax, in transporting clients of Shepherd Center to Western Fairfax Christian Ministries for their food bank appointments. And so we actually started a conversation with WFCM before the pandemic started about helping people who are not seniors get to the food bank, because transportation is such a challenge out there with the buses. And if you have a family or a mother coming on a bus to come and pick up, their monthly allotment of food and having to take it on a bus for 2 hours in 90-degree weather, well, that's, an issue. And so, and one of the biggest, and in a lot of our sort of findings, really, we have found that access to transportation is a big challenge for people who, depend on services that like Western Fairfax Christian Ministries. And so we actually are able now, as part of our pandemic response, to help families and individuals with food deliveries from Western Fairfax Christian Ministries as well. We believe that this is something that we were working on before the pandemic, and the idea was to be able to provide volunteer transportation, to provide Western Fairfax Christian Ministries with the tools to provide volunteer transportation to the pantry for individuals and families, not just those that are 55 and over. Now we've sort of pivoted that to a delivery because of COVID, but we anticipate after COVID that this is going to be a program that we're going to continue, because that is a challenge to a lot of individuals with food access and transportation, for sure.
And the other is HealthWorks. And so, you've got federally qualified health centers that are not necessarily easily accessible through public transportation either. So it's kind of like you could get free health services but you have to get there. And, and another thing that we've talked about in my Rotary Club too, is because we're doing a little free library out in Centerville, two of them, is that people can't get to the library. If you don't have a car, or you can't, you have, children who are not going to school have no access to books either, because there's no place to get them. And I think a lot of us have not sat down to really think about all the ways in which we are isolated from things like healthcare or the library, and not just the grocery store. And the fact that, public transportation is a challenge in Northern Virginia. If you don't own a car, you are isolated. And
right. And when you think about the seniors that we help, very oftentimes these are people who in their, before they were not driving, they maybe only ever drove in the suburbs and they never really used public transportation before. So imagine having to sort of lose your independence and then have to navigate a whole system that you're really not very familiar with, on top of the fact that that you might be older, you might be frail. So it's really not an option for a lot of the people that we assist. And cabs and Uber and Lyft are also not a great option as well, because it's cost prohibitive if you have multiple appointments that you need to attend every week, like physical therapy. We've seen a lot of telehealth now with a lot of the clients that we serve have been able to do some telehealth, but again, there's the technology piece of it as well. That's a challenge for many. And so, we saw a real decline in our ridership in the March, April, May, sort of beginning of the pandemic. But then as things started to slowly open up again, we saw our medical rides go back on track for where they were, because people were really, needing to get to their preventative and their wellness and their follow-up appointments. And not all seniors can really access telehealth. I think it's pretty straightforward for a lot of younger people to just be able to FaceTime with your doctor, but that's not something that's very easy for an elderly person to do.
And that's part of the problem too, even with Uber and Lyft. If an elderly person just uses the telephone, then Uber and Lyft and having an app or not owning a smartphone is not helpful. So the fact that NV Rides, you have a telephone-based service is huge.
Right. And actually, there is just to give it a little plug, GoGo Grandparent is something that you can look up, because what they do is they are a third party for Uber and Lyft for seniors. And so it gives a landline. And so they will book an Uber through a landline for a senior. And so we recommend that sometimes. I mean, that's another piece of NV Rides is this. We are really promoting volunteer transportation as a viable way to help seniors stay independent once they stop driving. But really, we are, I'm sorry, I lost my train of thought on that for a second.
It's all the tools available for seniors. And so you're kind of a hub for helping people discover things like, I've never heard of GoGo Grandparents. So you just taught me something.
Right. So exactly. So if we can't find a program for an organization, or for a client looking for rides, then we'll try to find other, access points for them. If they're not in an area where a partner operates, which is very rare because we are pretty well covered. But for example, because of the pandemic, Prince William County, our partner out there, is still suspended, and we are waiting for them to come back online. So right now in that area, we really don't have a volunteer transportation option, but we can always, what we do is we work with the caller to really navigate what other options could be available.
And so how do you see the vaccine rollout impacting all of this? Two questions I have. Seniors have to get to the vaccine, and sometimes that is a drive-through or it's an appointment-based thing. So even if you register online or however you register, and they say your appointment's Tuesday at 3 p.m. for your vaccine, seniors have to get there. But once they get both vaccines, though, they're in a better place. They still should be wearing a mask, but they're in a better place actually to take advantage of more services.
That's right. Yes. And, we are right now, our partners are with the clients that they are assisting. They are driving them to vaccine appointments, but we also have a partnership going now with Fairfax County. And if somebody is in need of transportation to a vaccine appointment and they're not yet signed up with one of our partners, there is a hotline at Fairfax County to call the health department at Fairfax County, and they will refer you over to a transportation hotline to help you with a transportation voucher to get to your appointment, because we know that the nature of these appointments, people are getting callbacks and their appointments are coming up really quickly. So it doesn't give a lot of time to scramble to find transportation if you don't have any. And so if you call Fairfax County Health Department, they will direct you in the right place.
And so some of your drivers who are sort of in the over 50 category themselves will also be getting vaccinated too. So as the weeks and months go along, the drivers who are volunteering will also be in a different place as far as all of us feeling safer about sharing a car ride.
Right, that's right. And one other thing to mention is that one of our real focuses in the last year is to really spread the word amongst younger people that volunteer driving is such a great volunteer engagement activity. Before the pandemic, the average age of our driver was about 67. Now, many of those people have gone on hiatus until after they're vaccinated, and we are anticipating that there might be some that just don't come back, or maybe, just like people are now making decisions about possibly retiring early, we have the same situation with our volunteer drivers. And also there are, a lot of these programs have been in operation for almost 20 years. And so many of the drivers are aging out. So we're really looking to recruit a new crop of younger volunteers now we anticipate, workplaces staying flexible in that there will be some hybrid models going on and people will be working from home. And so we're trying to communicate to people who are working that during the day, if they're working from home, they can give a ride. If they're running to the grocery store, they can take one of their neighbors to the store and give back to their community in that way, since things are a little bit more flexible with working now.
That is brilliant. That's a whole show by itself, which is
employer
flexibility. Employer flexibility, creating this whole new cadre of volunteers who were never able to volunteer before, and to get back to their neighbors. Exactly,
because our programs operate 9 to 5 Monday through Friday, and that's when doctors' appointments are, and that's when seniors go to their their checkups. And so, it's hard for a young professional to do that type of activity. But now that we're having a little bit more flexibility in our workspaces, then, we really welcome that. And hopefully I'll come back to the studio and we'll talk about that next time we see each other.
Absolutely. Thank you so much, Jennifer. And I encourage everybody to go to their website, because this is what you need to know.